Good morning. Thank you to the scientific and organizing committees for allowing us to present our research here in Florence. We are presenting some long-term outcomes following vaginal reconstructive surgery with synthetic mesh augmentation from our institution. This work was supported by intramural grants from the departments of obstetrics and gynecology and urology. The objective of our study was to characterize long-term outcomes following vaginal reconstructive surgery with synthetic mesh augmentation. Our primary outcome for this analysis was reoperation for mesh-related complications, and we also looked at secondary outcomes, including rates of mesh-related complications, even those that didn't require reoperation, as well as overall reoperation rates. This was an IRB-approved retrospective chart review of patients who underwent vaginal surgery for prolapse, specifically including those who had synthetic mesh augmentation between 1985 and 2010. We abstracted data regarding the index surgery, relevant medical and surgical history, and short and long-term complications. We also invited all patients to complete a written survey by mail and invited them to come in for a pelvic exam, and if they came in, they received $20 compensation for the transportation. We identified a total of 800 patients using CPT and billing codes that were used over that time frame. Of those operative notes reviewed, 646 patients were excluded, the vast majority because they underwent vaginal prolapse operation without synthetic mesh augmentation. 3 declined participation when we mailed them the invitation with the survey. So in this analysis, a total of 158 vaginal surgeries with mesh placement were included. 68% of those patients did not have mesh-related complications documented in the medical chart or in the patient survey responded, and 34% did experience a mesh-related complication. The rate of vaginal mesh extrusion was 30%. The rate of mesh erosion into the bladder or rectum was 1%. Of the 34% who experienced a mesh-related complication, 33 women, so 21% of the overall sample who had mesh placed at their initial surgery, underwent a mesh-related reoperation. Factors associated with reoperation for a mesh-related complication on multivariate analysis included younger age, apical mesh placement at the time of index surgery, and urinary tract injury at the time of index surgery. The overall reoperation rate was almost 30%. Common indications for reoperation other than mesh-related complication, as we've already discussed, included subsequent development of pelvic organ prolapse or urinary symptoms. In conclusion, with up to 25-year data following vaginal mesh placement, 1 in 5 women underwent reoperation for mesh-related complication, and half of those reoperations happened in the first 2 years following the index surgery. 1 in 3 women underwent reoperation overall. Younger women, those who had apical mesh placement at the time of their index surgery, and those who had lower urinary tract injury at the time of their index surgery were significantly more likely to undergo reoperation for a mesh-related complication. We hope that these data can inform our counseling in patients currently considering vaginal prolapse operation with synthetic mesh augmentation. Thank you very much for your attention. I welcome your questions.
Thank you for the interesting presentation. Please.
Cello from the UK. Heidi, I commend you for your honesty in presenting those data, because that mesh reoperation rate is much higher than most of the published literature, isn't it? But I suspect that your data are probably more accurate. My question really is, do you know what the reoperation rate is in your non-mesh cases?
That is a lovely study to do, and I don't know, but I imagine it is similar, but for other indications.
Yeah, it's quite important though, isn't it? Because then you've got to counsel patients, do you have mesh and run the risk of reoperation for mesh, or do you not have mesh and run the risk of reoperation for recurrence?
And there was a nice 2009, I believe, systematic review by Gowri Dawadkar and the group at the Cleveland Clinic that showed very similar reoperation rates, whether you had vaginal surgery without mesh, vaginal surgery with mesh, or abdominal surgery with mesh. It was just sort of pick your poison in terms of which indication for reoperation.
Yeah, thanks.
Nicholas Veit-Ruben from Vienna, Austria. Thank you, Heidi, for this wonderful work and important survey. I have just a question. Do you have any information about the level of training of the surgeons that did the mesh procedures? And the second question would be, what kind of meshes were used in this cohort?
Yeah, so the vast majority of the meshes were actually type 1. The level of training was attending, and it was an experienced gynecologic surgeon who was not fellowship trained, but did a lot of pelvic floor reconstruction. And the vast majority were performed by that particular surgeon, and the others were performed often with him as a co-surgeon.
Good. Thank you very much.
I commend you for your honesty as well. Do you have any data about the results of the reoperations for the people that had the mesh explanted? Because that's sorely lacking in the literature.
Oh, yes. So I apologize for not presenting that. I think it was a third of patients who underwent reoperation underwent another operation. So 45 patients underwent reoperation, 15 underwent another reoperation. And I suspect there will be more data coming down the pike. We just happen to have an early adopter of synthetic mesh augmentation at our institution, and we took the opportunity to sort of contact those patients who are still in town. I mean, it's obviously limited by non-response, and you can imagine that women who had a terrible experience might not respond or might not have come back, so we might even be underestimating. Interestingly, the 3 patients who removed their permission for participation, none of them actually had a mesh complication.
Thank you very much.
Thank you.